To you, health officials are once again bracing for a spike in COVID cases. One expert we talked to says it could start as soon as the dust settles from Labor Day. Fox County's Kennedy Harris spoke with an infectious disease expert to find out more about what to expect this fall. Kennedy, what are doctors saying now about where we are in this pandemic?
Well, the biggest thing doctors want you to know is that COVID is not gone. It's still here and still very contagious. Their expectation is that we'll see another spike leading into this colder season like we have in past years. The question that remains to be seen, how big of a spike and if the spike will cause more severe cases.
For years, it's been the same virus, new variants. And Dr. Helmut Albright with Prisma Health says that hasn't changed.
Just nobody talks about it anymore. And really nobody tracks it anymore.
Because of the trend and the availability of take-home tests, he says the number of COVID cases is severely underestimated. But hospitalizations show a trend.
We've had an increase in admissions and deaths in the hospital.
It's nowhere near as bad as it was a year ago, and it won't overwhelm hospitals anymore, but
even 50 cases a day in the hospital with COVID is a lot more than the 5 cases that we were earlier in the year.
And he says it could spike more. The predominant variant floating around right now is still highly contagious, but mostly mild. Experts are also keeping an eye on the next one.
No guarantee that it'll stay that way. The next variant may be significantly more virulent.
The new round of boosters approved last week protects against the current variant and possibly against the next one. Dr. Albright says if you haven't gotten COVID in the last 2 months, a booster in the last 6 months, plan to travel, or have a high-risk condition, it might be a good time to get another poke.
But if you're up for a booster, I think this new booster is potentially better.
And Dr. Albright recommends speaking with your healthcare provider to discuss if and when you might need the next booster. He says if not enough people get this next round, it could give the virus more room to mutate and evolve.